get started. Hi family, let's get started. Where are we? Alright, so once you come online, don't fail to say hi and tell me where you're watching from. Okay? Already you know my name is Dr. Joy Jex. I'm your one and only online eye doctor. Alright, so if you come online, just say hi in the comment section. And I've been asking my eye family to show me love by subscribing to my YouTube channel. If you are yet to show me that love, please make sure you click on that link to show me love by subscribing to my YouTube channel. I still need about 93 of us here, and we are more than that here. So we should be fast. I still need 93 of us in iFamily that will show me love by subscribing to my YouTube channel. So please make sure, if you have not yet to show me love, please make sure you do so by subscribing to my YouTube channel. I will be waiting for all those. Once you do so, please make sure you put in the comment section that you have done. Subscribe to my YouTube channel. Alright, so without wasting our time, our question basket is out again this evening. Alright, who is ready with me? Who is here with me to answer this question? You know, these questions are from people from different places, and why I decided to be answering them in live session like this is so that other people can learn. If I just answer it inbox and the person has learned, there are other people too that could be in the same problem or in the same issue, but they can, it's either they can't ask directly or they might not even know how to put it. But when I answer it in a public, in a live session like this, everybody hear it, and also even the people that doesn't have the same issue, you learn from it. Okay, so we keep learning every day, and this is about our eyes. Good evening, Ijoma. Good evening. Thank you so much for joining me this evening with live Q&A session with Dr. Joy. Thank you. Good evening. All right, so I'm saying you have to learn. All right, so when you learn, it will help you, so that if you're having such experience, you won't be in a dark room, like you don't know what to even do. That is what this place is all about. You won't have, thank you so much, you won't have problem and you don't know what to do with your eyes. You don't know. That is why people make a lot of mistakes, because they don't know what to do, because something is happening to them, because they don't have the right information. So what they do is to, they do a lot of things, put a lot of things in the eyes, do a lot of things. Some even cause them to lose their eyes or to lose their sight in the process of trying to manage something that wouldn't have caused them to lose their sight. So I'm going on to bring up question number 1 for today. Let's see the first person that will get. We are answering his or her question today. All right, I'm not looking, I just put in, I get it. Oh, okay, so this one is from Nigeria. Remember I said I'm not going to be mentioning the name of the people that is asking this question. I'm just saying it, I'm just answering it in a live Q&A session so that I want others to learn. Now let's read this question. It said, recently I noticed that my right eye cannot really see clearly. It's usually blurry, and I do feel headache sometimes. What can I do? Okay, so he said my right eye can't see, it's blurry, and sometimes I do have headache. All right, please, one of the things I used to say, there are so many things that could make your eyes to be blurry. If you have refractive error, that is anything that will make you to use glasses, like your astigmatism. I've done refractive error previously. It's like I'll also bring up those videos so that people can learn, like astigmatism, hyperopia, myopia, and all the rest. Once you have any of them, you are going to experience blurry vision. Okay, but for you, that is having blurry vision in one eye, the right thing for you to do is to go and test, because apart from the refractive error, dry eyes can make your eyes to be blurry, glaucoma can make your eyes to be blurry, a lot of eye conditions can make your eyes to be blurry. Now you can't stay in the house to determine what can make your why is your eye blurry. Even me looking, you are asking the question, I can't know. The only way I can know what is making your eye to be blurry is by testing. So if you don't test, you won't know why is your eye blurry, and then for you to be having headache, so you need to test. Because sometimes what people do when they have headache, they will go and buy paracetamol. That's why that paracetamol is almost the most abused self-medication that people take. So every little thing, they will get painkiller, now get paracetamol. Now if you are having headache, the right thing now to do is not to get paracetamol or to say what you should do first, go and get your eye tested so that you will know why that eye is blurry. Now if you delay in getting to know, it might get worse with time. So the right thing to do for this person that asked this question is make sure you go and get your eye tested with a professional so that they will find out why you are having blurry vision and headache in one part of your eyes. I hope that question is answered, all right? Let's go to the second question. This one is coming from Uganda. Oh, really? Okay, so he said, my father is diabetic and he is diagnosed with cataract. What? Okay, also he said, apart from surgery, what other solution? Good evening, precious. How are you? I hope you enjoyed your weekend. Okay, so excuse me. He said my father has what? Is diabetic and he has cataract. Now, if you watch the video I did on diabetes, I said one of the problem with diabetes is people that have diabetes can easily develop cataract. And remember, cataract is clouding of the crystalline lens. If that part of the eye, the crystalline lens is that part of the eye is cloudy, that is when cataract sets in. We have types of cataract, but for someone that is diabetic, you can easily develop cataract. Okay, so once that cataract is there, first is, I usually tell diabetic patients, once you are not properly managing diabetes, it's going to affect not just every part of your body. Your eyes will be really affected. So there is no other solution for cataract except surgery. If somebody is telling you to buy a medication, an eye drop, once you use the eye drop, the cataract is going to clear out, please don't go there, because the person wants to get that eye blind. So make sure you work with an eye care specialist to do your eye surgery, to do a surgery on that eye. If it's both of them, to do surgery on the both. And managing that diabetes is a key. Is very important. Now, you don't just manage, there's something people usually do, especially some of the patients, once they come, if you ask them, are you on medication? Yes. Number two, are you managing your sugar level properly? They will say, yes. What are you managing it? How? Are you working with a dietitian? No. They're eating everything. So please, manage your diabetes very well. Even after the cataract surgery, first is your question if there is any, or if there is any solution apart from surgery. There is no other solution for cataract. That's number one for you. Number two is let your father help him to manage that diabetes properly, so that he doesn't develop other eye condition associated with diabetes, because cataract is not the only eye condition associated with diabetes. There are other ones that are associated with diabetes. So he needs to work on that. Very important. Now let's go to number 3 for this evening. Say, what causes regular eye pain? This eye pain. Eye pain again today. All right, my people. Okay, so let's go. First is, like I used to say, If you're having regular eye pain, don't ignore it. Ignoring eye pain, that's why I've told you guys, get my book, Common Mistakes About the Eyes. I dealt with all of these things. You read and get knowledge, you keep it. All right, so that you don't, because if you're having regular eye pain, because I think I dealt with this eye pain in this my book, Common Mistakes About the Eyes. So please, if you're here to order for the book, get the book for your own good. All right, so what causes regular eye pain? If you're having regular eye pain, there are a lot of things that can make your eye to be painful. Number one is increased eye pressure. If your eye pressure is high, sometimes it could lead you to have eye pain. Dry eye sometimes could make you to have eye pain. There are a lot of things, unmanaged or uncorrected refractive error. When I say refractive error here, please guys, you should know that I'm talking about anything that will make you use glasses. Let's put it in that sense, okay? So if you have uncorrected refractive error, it could make you to have pain. Now this person is asking about regular pain. And I will advise you, well, you are not, whether you are the one that asks the question, you are not the one, as long as you are here, just do not ignore regular pain in your eyes. Do not ignore it. It could be other things even related to your health. So please, when you have regular eye pain, do not ignore it. It's very important. Seek for a professional, seek for an eye care a professional that will test your eyes and know exactly what is the problem. Why are you having this pain? You know, there's something people don't know. You know that from eye test, we refer people to go and see a neurosurgeon. I know you guys don't know that. From eye test. Because sometimes it's not just about the eyes. What is happening to the eyes is coming from the brain. Several times I've referred people and then you see them, they have to do a CT scan. And somebody will ask, is he also part of the eye? So please, when you have eye pain, do not ignore it. Please make sure you see your eye care professional. And I also want to say this, if you don't have any eye care professional that you go to, when you have I will usually say, go and test your eyes, and then you don't have anyone you are going to test your eyes, you've not tested your eyes, I don't know what to say to you. All right, so let's go to the next question. Our basket of questions is just left with 2. Now this one is coming from Nigeria again. This question, it said, what causes glaucoma and is it treatable? Okay. First is, when we are talking about glaucoma, there are a lot of factors, there are a lot of risk factors to glaucoma. Number 1 is hereditary. If any family member has glaucoma, you are at risk of developing glaucoma. Have this at the back of your mind. Now, I usually tell my patients that have glaucoma, I used to tell them, if you go home, inform especially the parents, as if you go home, don't keep it and be taking the medication or be on the treatment without informing your kids or without informing people around you. Because once one person is diagnosed of glaucoma, every other person around that family is also at risk because it's hereditary. Number 2 is high refractive error. Like people that are nearsighted or farsighted, but their power is very high. You are also at risk of developing glaucoma. Number 3, if you are hypertensive and also diabetic, you are at risk of developing glaucoma. If you are beyond the age of 40, you are also at risk of developing glaucoma. There is a particular eye drop it's not just a particular one. One is what will I call it? We call it steroids. Now, sometimes what people usually do, because most times when you use it, it clears redness as fast as possible. Now, some people keep buying it. Now, if you use this steroid, the eye drop, any eye drop that has steroid for a prolonged period of time, you are banned, you are at risk of developing not just glaucoma, also cataracts. Now, these are the things. If something hit your eyes in the past, this is very important, because something will hit your eyes and you will go to somebody close by, or to a pharmacy, or to in Nigeria we call it chemist, to go and buy an eye drop. You say, it has gone. If you don't treat an injury, something that hit your eyes, whether it's by mistake or by accident or by anything, something hit your eyes and you didn't manage it properly, it can make you to develop glaucoma. Okay, so these are the things that can make one to develop glaucoma. I hope the person that asked question is here so that you can get all of this. Now, is glaucoma treatable? With glaucoma, what we do is to manage it. There is no permanent cure for glaucoma management, for glaucoma treatment. Now, the research is still on an eye drop or a solution or a surgery or a procedure that can be done with a patient with glaucoma, and that will be once and for all. That research is not yet done, because I'm writing a book on glaucoma. So that research, I was making series of research. That research is still ongoing. There is no permanent cure currently for glaucoma. What you do is to manage it. You either manage with drop or with surgery or laser and all the rest you have. But if there is a permanent treatment that once you use it, it will go, there is nothing like that for now. Maybe when we are done with our research, we will bring up something for you. Okay? All right. So let's take the last but not the least. Everyone that joined us this night, I'm really grateful. Thank you. Please make sure that you invite others to join and share the video so that people will learn. There is nothing we've said here that anyone doesn't need. So everything I've said, people need to hear them and learn. So please, if you are here, make sure you share the video to groups so that people can learn. The most important thing is for people to learn. Let people learn so that all the mistakes that happen with the eye can be reduced, if not completely stopped. Okay, so let's go to the last one. The last one is coming from Namibia. My people. Okay, he said, what can I do to stop using glasses? Oh my word. This one, I need to adjust my chair very well. All right. He said, what can I do to stop using glasses? I know a lot of people have been asking this question, especially those people that are using glasses. They are saying, what can I do to stop using glasses? Is there any food I can eat? Is there any medication I can take so I can stop using glasses? Should I tell you the answer? The answer is, there is nothing you can do to stop using glasses. If you are nearsighted, you don't want to use glasses to an extent. If you are nearsighted to an extent and you don't want to use glasses, we will refer you to go and do laser refractive surgery. Now, laser refractive surgery is not for everyone. So I don't know, the person that asked this question, I don't know what your prescription is. Whether you are nearsighted, farsighted, astigmatism, presbyopia, I don't know the particular one. Now, if it's nearsighted, yes, you can go for laser refractive surgery, then that will be the end. But even with laser refractive surgery, sometimes there could still be a small power for you to still complement. Sometimes, in quote, okay? But for others, If you are presbyopic and you don't want to use glasses, you can also get that, where they have to put multifocal IOL and you can use it. But apart from that, glasses is not harmful. It makes your eyes, it makes your face to look beautiful. So please keep on using your glasses. All right? Thank you so much this evening. That comes to the end of live Q&A session with Dr. Joy today, Saturday. Thank you for joining me to answer these questions, and I know you've learned something. When you learn something, I would like you to also put in the comment section what you have learned today, live Q&A session with Dr. Joy. And don't forget to invite others to join us here. If you are here to show me love by subscribing to my YouTube channel, don't forget to do so and click on the notification button so that you can get my videos as I drop them. Thank you. Have a lovely night rest. Enjoy your rest. Bye for now.